Yes, sir. And it's useful in kidney stones. Can we use this also, or does it have any action on the gallbladder stones as well?
As such, for the purpose of gallbladder stone, it won't be useful directly, but by you concept wise, we can try it, but may not be sufficient because this particular Goksura has a special action on renal parameters and renal functions. So I don't think so. It is going to help in any way to the cholelithiasis condition.
And regarding um, it's also a mootrala, meaning it improves the urine output,
Good.
kind of has a flushing action. Is the flushing action the reason behind its kidney stone breaking effect, or it has standard lithotriptic kidney breaking effect on its own?
It has both the actions. It has a braking effect as well as a flushing effect. Both the things are being done by this. It not only improves the filtration, urine filtration, it also even helps in removal of the crystallization, and it also helps in the destabilization of the stones, and even the cracking of the or cracking opening of the stones for many things. So it is not simply just because of flushing effect. It is not only flushing effect. If you want to have a flushing effect, even water can flush it. You can plentifully you can drink water, but it is not so. That's what usually the people will be guided by the other side of the Western practitioners, that you drink plenty of water. Just by simply drinking water may not flush the things. There are certain requirement is there, and this is one of the important drug which has a special effect of breaking and as well as flushing the renal stones or the kidney calculus or renal calculus.
Because it can increase the urine output, and a standard diabetic patient will be also having polyuria issue. Should we be careful while using it in, say, diabetes?
See, it's not a question of using it in diabetes or something like that. See, our intention is not for the diabetes. Our intention is for the kidney function improvement. If a person is able to expel the sufficient quantity urine or not, in such a mutra krichrata, urinary tract infection, and all those conditions, we use it. Our intention is not to increase the urine output in a patient who is already suffering from diabetes. So that is not an intended case here. So when we are selecting a patient, of course, if a patient is there, he is a diabetic, even with the diabetes, he is also have kidney stone. Then you can use it, no issues. You can use the drug Goksura even in that condition. This will help in flushing out as well as removing the kidney stones.
And